Hello, I'm glad to be among you today. Global OncoThon 2026 on 4th of February 2026, the World Cancer Day. Title is Why is there a need for win-win game changing in global oncology? I am Ahmed Elzawawy. Uh, I'm chair of Win-Win Initiative, chair of board of director of Global Oncology Implementing Science. Voice. It's part of GoU, founder, president of ICDoc, Experiencing Cancer Without Borders, past president of Aortic African Organization for Research and Training in Cancer, professor of clinical oncology, Suez-Canal University, Ismailia, Egypt, and medical founder of Al Salman Radiation and Clinical Oncology Center in Port Said, Egypt. Disclosure of interest, none. It is a call for all cancer care professionals, societies, organizations, institutes, health industry, and all who are concerned with affordability of cancer care in the world. Changing game of global oncology has become a must, not a choice. Otherwise, after 10 years meetings, an organization will continue discussing widening gap in affordability of better value cancer care. That will be worse at that time than now. Hence, the new generation will ask why you continued the same and you didn't change. Remember this. Despite the boiling and crazy world around us, we try to disseminate message of love to all and action through science for the sake of millions of human beings with cancer and their families. To summarize, one is for the sake for numbers increasing number of millions of cancer patients in the real world. All concerned professionals in the world are invited to advocate. All are invited to advocate and to co-lead their contribution in game-changing global cancer now and in the future. We don't claim any praise or presidency. The initiative belongs to all. The common goal should be increasing remarkably the affordability of better value cancer care with dignity for cancer patients in the real world through science. There are scientific solutions, and these unpublished, all, but unfortunately, they are not highlighted and they are overlooked by intentionally or not. They are published by many authors. There are wide possibilities of focus, studies, scientific studies, research, and innovation. There are billions, not millions, billions of dollars wasted. Please watch, read thoroughly, and forward to your colleagues. Don't stop this call in your PC. Let us think together, whatever the value of new expensive cancer treatment, if the tragic gap continues, then what is the value of new treatment and expensive if it's not affordable? And the gap is increasing, even in the United States. There are for some patients in United States, certain fraction. Also, the affordability is difficult. Over the last 3 days, despite the decades, despite all the respectable efforts, we say respectable, we are deeply appreciated to all this effort, but of all organizations, societies, institutes, plans, declarations, thousands of important publications, conference, and oncotourism. Yes, oncotourism, that in fact are paid at the end by patients. Talks and recently hundreds of podcasts, however, the affordability crisis persists. Rising cost of cancer aren't matched by improved outcome, risking healthcare system collapse or will lose. The problem isn't the player, it is the game itself. Please imagine all these efforts collaborate and concentrate mostly on how to increase remarkably the affordability of better value cancer care in the real world through science. Imagine if it's happened. This is what we hope. It's needed, become burning issue. So it needless to waste time or dispute about the fact that with all these efforts, the gap is widening. It is not a waste of time. We should think for solutions. If that will not be called failure, then what could be called? So the issue is not about these loud announcement talks, projects, while the real outcome is just few services here and there, and that more than 70% of cancer patients in low middle income countries, particularly, have no access to reasonable care. According to ASCO survey, the first cause of fear of cancer among around 40% of patients in the United States is the cost and fear of family bankruptcy. You imagine this. A study of ESTRO, European Society of Radiation Oncology, more than one-fourth of patients in Europe didn't get the indicated radiotherapy. Here is the reference. It is estimated that there is a shortage of around 1,200 radiotherapy services units in the world. Shortage. It may be more. So correct me if I'm wrong, but this is estimation. Surprisingly, there are many published scientific approaches that could be lead to lower the cost without compromising the outcome. But unfortunately, they are not frequently mentioned. Second thing, that there is room for unlimited ideas and research that could serve the goal. Science. Three, there are also waste of many 10 billions. Four, there are potentially fatal side effects that are not highlighted neither by the FDA nor by high impact journal. Could anyone tell us why this is the important, the above important issue and serious issue are not highlighted in organization, publication, expensive big conference and podcast? Why? Why is not highlighted? If we continue as we are, health system would not cope with the skyrocketing rise in cost. In the Win-Win Scientific Initiative Goi's program, we advocate for lowering the remarkable total cost and remarkable increase of affordability of better value cancer care through smart scientific approaches. All will win. We are not at all offending any industry. All the stakeholders, including patient, cancer care professional, or community science, government, health, and health industry, will win. Even the business of healthcare, all healthcare will flourish. In the real world, why it should be win-win? Because the incentive and interest of all stakeholders should be considered to be realistic in the real world. Some example of many. It is scientifically possible to reduce the cost of some expensive treatment via scientific ways by 70 or 80%. You imagine this. And without compromising the outcome on patient. Please see many examples with references. We didn't invent anything. There are references for everything. There are many examples in Goy's series and books, chapter 14, 15, 23, and here is also Ratan, Lichter, Tanok, and there are many references. One of the important aspects to get better value care is to have less toxicity and reduce the suffering of patients and reduce hospitalization due to complications. So could anyone or any organization or our societies or institutes or any guidelines tell us why, despite that it has been reported that 58% of potentially fatal adverse, even fatal, potentially fatal, are not listed in the initial USA label, and 30% are not reported in any published randomized trial or even in high impact journal, and not highlighted in any conferences and of big oncology societies. Here's the references. The dose of many of the new drugs approved by FDA over the last decades were higher than it should be because of the FDA approved these drugs based on maximally tolerated dose, which is not right. Hence, all guidelines and big conference follow the unnecessary high doses and cost that leading to off-target adverse events that may be fatal, as in the case of ibrutinib. You imagine this. The good news, after many publication, presentation, and pleased by many experts, including us, okay, FDA has launched the project Optimus for reforming those optimization and those collection paradigm in oncology. However, according to Professor Antano, unfortunately, the FDA applies that correction for what will come and not for the previously approved. We are a forum open for all and owned by all, not replacing any. We are for open collaboration. It is doctor, scientists, and healthcare experts need to drive ideas, studies, plans of change, and they should not wait for policymakers or administrators. Otherwise, they will wait forever. We should not be part of the problem, but an essential part of creating scientific, realistic solution. If you are not creating solution, who will create it? And then you raise this for discuss it with the policymaker, with the administrator, with the economist, etc. Since the start, we agreed together in the win-win scientific initiative and its global oncology implementing science on what GSP Curigliano, ESMO president-elect, recently summarized: only through collective leadership, shared responsibility, and science-driven win-win solution can we move from principle to the real world impact. In GOIS and in the win-win, we call to disseminate the message, repairing the compensation system for oncologists and cancer professionals. That's if we want to be serious, if we want to be serious and realistic in the real world. Otherwise, many parts of the world, corruption will continue and many other things. Commission, etc. We stress that remuneration for good living to all cancer care professional, and I dare to say to the decision maker, will as well could be the first step to save a lot of money that goes to expensive nonsense prescription of treatment and investigations. One example of many for the need of the redesign of real world health system. One of the recent articles estimated the cost of referring cancer patients from East Africa. I said this is for as example, but it's present in other parts of Africa also. From East Africa to India by $2 billion annually. Reference in the next slide. This cost goes to clinics in India, commission percentage to the referring cancer doctor in East Africa, and the agent in between, and drug company, etc. Without offending anyone, the sum of $10 billion in 5 years could establish local high-quality cancer service and systems with dignity to local patient, while all will win. And also the local doctor will not immigrate or nothing, because they have a good service to gain a good career. With these centers, $10 billion in every 5 years. Other institutes or clinic in foreign countries like India, France, UK, wherever, could contribute as partner to work with. This is just one example of many of what is going on in many other countries, Africa and others. Is it much better than wasting resources of IEA, hope, raise, taxpayer in each countries and others, etc., in establishing few centers here and there and keeping hence they could keep their resources for technical and development aspects. Could you change the game? We think that's necessary. What do you think? There is reference about this East Africa and countries in East Africa. Isn't that better to change the stereotype talks and begging for help of many international organizations, conferences, summits, and hundreds of applications over the last 3 decades, while the gap between the needs and the affordable better value in the real world is widening, and it will worsen. Isn't that enough proof to change? Do you imagine that the industry spends 35 billions dollars annually in USA marketing pharmaceutical, much of it directly to the physicians who reported in a big study that marketing interactions threaten trust in medicine and in us as clinical oncology and doctors and cancer doctors. Just brainstorming question for your kind feedback. Think about it. Could this sum, among other sums of bad allocation and resources, go to improve remuneration of cancer care doctors, cancer care professionals, not necessarily as salaries, but as big award for providing better value cancer care, for training, and for generous grants for research that are focused on how to increase via science the affordability of cancer care? However, in the real world, such suggestion will never be realized unless companies study and formulate diverse creative approaches. After a smart pilot study, if companies find a strong possibility that this approach could not only lower total cost and increase affordability of their product, but also boost sales, their own sales, flourish their usual markets, and potentiate weak market, and maybe also dead markets, strengthen the health system, and prevent depression. With depression, all will lose. In such case, implementation could be realized. What do you think? Do you prefer to go like we are, or you think that we have to change? Surely the field is open for all innovative suggestions and smart ideas, and these and should be open for innovative ideas out of the books also. The books. Efforts to launch a global cancer fund without repairing the big current effect will just help more corruption and abuse. It is like trying to fill a tank while you are not wisely using the water. To abuse a lot that could be spared with scientific evidence, and while there are big holes in the bottom. Previous similar initiative never succeeded to reduce the tragic gap in affordability. My innocent question, shall we continue like that? Or there should be game-changing formulated, accorded by many, and co-leaded by many players and institute and organization in the world. All will win. Otherwise, the system may not cope. The question is between your hands. The win-win is a notion and working groups. Hence, it is not competing with any organization. It's not in rivalry. It could be adopted and adapted by any. The win-win is a message of love expressed in scientific exploration and collaboration to serve a cause of affordability, better value cancer care. Here is our web, and please contact us and let us hear from you, your feedback and commentary, and even criticism. If we are open for all your comments. All what state is here is on behalf of all leader of guys. What I present here will be only of value if you adopt and make it belong to you all. Feel free to modify, to improve, and to lead. Millions of cancer patients and their family are screaming, don't let us. In Goyes, the win-win scientific initiatives are attached to the definition of dignity for human being of patients as physical, financial, and social dignity. Please don't let them down. Going forward in fruitful cooperation, thank you. And I would like to say again, going forward in fruitful cooperation and waiting for your precious feedback, please send to us. Bye bye.